All right, thank you very much. I appreciate that. And good evening to everyone. Thank you for joining us for the biannual Women Veterans Forum, sponsored by the VA Maryland Healthcare System. My name is Chris Buser, and I'm the Deputy Medical Center Director for the VA Maryland Healthcare System. And I'm delighted to be joining you for this wonderful public forum. The purpose of today's gathering is to share information about the programs and services available for women veterans throughout the VA Maryland healthcare system, to better understand your healthcare needs, and to gather your feedback to ensure that we're providing safe, quality, and compassionate care in an excuse me, I can't speak, in a sensitive environment. We have had lively discussions during the last forums, and your valuable feedback allowed us to better address the needs of women veterans throughout the healthcare system. We host women veterans public forums twice a year to help address any ongoing healthcare needs and to keep you abreast of the latest programs and services being offered to support women veterans. So look forward to another invite in the next 6 months. Today's forums will be recorded and posted to our website. To view that recording, please visit maryland.va.gov at least 48 hours after this evening's forum. To protect your privacy, please do not share your personal health conditions or any personal identifiable information during the question and answer portion of the forum. Please use the chat option to post your questions. Microphones have been muted. If you do have any specific medical concerns, please contact your VA provider. Thank you again for joining us and for sharing your feedback. Before we get started, I would like to introduce Dr. Sandra Marshall, the Chief of Staff for the VA Maryland Healthcare System, for a few remarks. Dr. Marshall?
Okay, thank you, Mr. Buser. So good evening to everyone. I'm really excited to be here this evening, and I'm delighted to be part of our biennial Women Veterans Public Forum. I've been on these a number of times, and they're always very useful and wonderful times that we spend together. So as Mr. Buser indicated, I'm the Chief of Staff for the VA Maryland Healthcare System. And throughout my long VA career, it's been my distinct pleasure to serve the needs of our women veterans. So I'm looking forward this evening to hearing back from you and receiving your feedback so that we can better serve you in the future. I am going to introduce and let you know who's on the forum today. So joining us on today's forum are the following members of our Women Veterans Program for the VA Maryland Healthcare System. First, it's Dr. Catherine Starpoli, who she'll pop in there. There you go. She is our medical director for the Women Veterans Health Program. And then there's Miss Siobhan Kirksey. She was the one there that said hello at the beginning. She's our Women Veterans Health Program Manager. Miss Janita Robinson, who I think many of you may know. She is our Women's Health Nurse Case Manager. And I saw Dr. Rachel Austin a little earlier. She is our Women Veterans Health Program Mental Health Champion. And then we have Miss Maisha Pope from Social Work, one of our most critical positions. And then Miss Saya Yates, who's with our Physical Therapy Department. I'm very excited about having her. And then Dr. Catherine Vega Sanchez, who's our clinical pharmacist for the women's program. Yeah, so everybody got on without any problems. So now I'm going to turn things over to Ms. Kirksey and Dr. Starpoli for a presentation about the VA Maryland Healthcare System Women Veterans Health Program.
Dr. Starpoli, I'll allow you to any additional comments before we get started or feedback for our group this evening.
Yes, I wanted to welcome everyone. I've also been on all of our forums and they've been exciting. We've been able to talk about various new programs, the programs that we have, and we really want to get out the word about the great work that we are doing with women veterans here and the services that we are offering and the culture change that has occurred throughout VA in the last 20 years that makes it your VA as well. And I'll let you go ahead and talk, Siobhan.
Thank you so much, Dr. Starpoli. So we have a quick presentation on the highlights and changes since our last forum. But before we hop fully into it, I want to take the time to honor and say thank you. As we know, the month of March for us is our Women's History Month. And during Women's History Month for 2024, our VA's Office of Women's Health is honoring Native American women veterans. The VA recognizes the impact your advocacy, contributions, and sacrifice have made on our military history. Native American women veterans have had an exemplary tradition of military service for over 200 years, overcoming both adversity and serving at high rates compared to any other demographic, demonstrating your decision in our country and our everlasting commitment to service. Today, women make up about 11.3% of our Native American veteran population, which is a higher percentage than women in all other demographics. During World War I, several Native American women volunteered to join the American Nurse Corps before they were even considered American citizens. During World War II, our Native American women volunteers grew to about 800, joining various branches of military, including the Women's Army Auxiliary Corps, Women Reserves, or Women Accepted for Volunteer Emergency Services, Women Marines, Coast Guard, Women Reserves, and Women's Air Force Service pilots. Native American women continue to serve throughout our history during the Korean War, Vietnam era, Persian Gulf War, and post 9/11, and in several notable roles from nurses to pilots and more. Native American women now serve in all branches of our armed services. So we just want to take this moment and opportunity to honor and thank you for your service as we do a quick presentation. So a little bit about our agenda this evening. We will cover our women's health program offering, just a quick recap. Then we'll talk about some reproductive health updates. We'll focus a little bit on women's health appointments. There's been some concern in regards to language and just understanding the type of appointments and service levels that can be provided to any of our women veterans within the clinic. We'll talk about the Women Veterans Drum Circle that's getting started, as well as a few additional new support groups and offerings that we have. And then we'll open the floor up to any questions that our participants on the call may have for us. So just as a reminder, our women's health program offers women veterans comprehensive health care, which is including primary care, which is in our women's health clinic or our primary care clinics, but provided by a comprehensive women's health medical provider. We have gynecological services, maternity care, fertility and infertility services, childbirth education classes, and our postpartum support. We continue to offer ultrasounds and mammograms, both on campus as well as in the community. We also have access to mental health care and counseling. We provide lifestyle wellness services, or the term that we use here is whole health. And then I can't forget about our recent expansion with the pelvic floor physical therapy program to help support all our needs throughout the course. Our mental health services are very vast, which include military sexual trauma, as well as intimate partner violence, and we continue to grow those aspects of our program. So now a little bit about our reproductive health updates. So recently, as many of us know, there was an overturn over Roe versus Wade through our government officials. And with that, the VA has stepped up huge. So we seek to ensure that our veterans have access to a full range of reproductive health services, no matter where they reside. So we also realize that certain states have begun to restrict reproductive health care, creating urgent health and safety risks, particularly for our pregnant veterans. In consultation with VA healthcare providers and veterans nationwide, the VA has determined it is medically necessary to offer abortion counseling, and in some cases, we are offering abortion services. Specifically, the VA is acting to make abortion counseling and abortion in cases where the life or health of a veteran is endangered available to enrolled veterans. This includes abortions in cases of rape and incest. This change was delineated in our package under the 38 CFR 17.3A, which is provided under our VA's federal authority to help support our veterans across the country that may need access to these services. So currently what we provide is the VA provides menopause care, fertility services, contraceptive, emergency contraceptive, as well as maternity care, including life-saving treatment related to pregnancy. This may be medically necessary care for veterans presenting with ectopic pregnancy and miscarriages. So how will we implement and provide these services? Women's health providers and staff can provide abortion counseling and services. The VA will pay for abortion counseling for community providers where available resources may not be available for eligible veterans. The VA will also pay for abortions from community providers in cases where life or health of the veteran is endangered if the pregnancy were carried to term, or in the case of pregnancies resulting from an act of rape or incest. There is no burden of proof for women veterans enrolled for the VA healthcare in need of a medically necessary abortion for rape or incest. So we take a team approach to being able to assist our veterans across the state of Maryland who may be in need of access to these services. That team approach is this team here that works together. So myself, your Women Veterans Program Manager, along with Dr. Starpoli, our Women's Health Medical Director, all work together with our Maternity Care Coordinator, our gynecological staff, our Women's Health Pharmacists, our Women's Health Mental Health Champion, and we also partner with Care in the Community to ensure that our women veterans have timely access to needed services. Our community partners that we participate with, and this is in collaboration with our DCBA. So we have partnerships with the University of Maryland and then also with Washington Hospital Center. And we have that partnership to make sure that we are able to sweep both parts of Maryland. And we are working on establishing and extending those invitations to the Eastern Shore to ensure that our women veterans on the Eastern Shore have appropriate access to care and services as well. So there'll definitely be more to come on how we continue. With that team approach, what that means is we are able, sorry, jumped ahead there. We are able to provide counseling with one of your women's health providers. And then if a decision is made that those services are needed, this team will help coordinate, monitor, and manage your care, connecting you with appropriate services timely, and being able to follow up and help support after any procedures or counseling that are needed to make sure that we are optimizing both your physical health, but as well as your mental health moving forward as well. There's been some recent changes that actually just was released on yesterday, which was excitement for our entire team here. So the Department of Veteran Affairs has announced that it will soon be able to provide in vitro fertilization. Most of us know the term as IVF to eligible unmarried veterans and eligible veterans in same-sex marriages. The VA will also be able to provide IVF to veterans using donated sperm or eggs, a critical step toward helping veterans who are not able to produce their own sperm or eggs due to service-connected injuries and health conditions. There will be more information and news to come because this is like hot, fresh off the release. But your women's health team here is coordinating to helping support anyone that needs additional access or has additional questions in regards to this recent change. Next, we're going to spend a little bit of time talking about health appointments. And these are meant to be brief and high-level generalizations, but we want to make sure that our women veterans understand the types of appointments that they can have access to within the clinic, and how those appointments can kind of help with their overall health and well-being. So the first is a well woman exam, which many of our women veterans are very familiar with. The components of this exam may include a history, vitals that are taken by the LPN or registered nurse within the clinic. There is a pelvic exam that would include pap smear or any additional STI testing, as well as possibly a manual breast exam within the clinic and an order for a mammogram if it is needed at that time of service. And then there may be additional labs that are being ordered by the provider. Now, if this well woman exam has normal results, meaning your pap smear comes up normal, the new recommendation that's been provided by our reproductive health offices, and not the VA reproductive health offices, but our reproductive and family planning offices that we follow national guidelines for, recommends that women be tested every 3 years if they've had consecutive normal readings. However, if a pap smear has resulted in abnormal results, then the frequency of screening and follow-up will be based on the provider's recommendations on how we handle care, and that's handled on a patient-by-patient basis. So it could be an additional follow-up in 6 months, or it could be an additional follow-up in a year. But that conversation would happen between you and your healthcare provider to determine what's appropriate to continue routine screenings moving forward. Um, Well woman exams can take anywhere up to a 60-minute appointment. So just as an FYI, because sometimes this becomes a little tricky and confusing when scheduling that appointment, just ensuring that it has been set up for about 60 minutes. Next is our annual physical exam, which at times this can actually be combined with the well woman exam. So there's still a medical history that is included and of course vitals, but this is where what we call a body systems check is done. The doctor may listen to your heart and lungs, take a look at your skin, take a look at your eyes, and evaluate all of your systems to make sure things are functioning appropriately. There may be questions about different systems like how are you eating and how's your diet and your nutrition. So this is an overall general exam to check everything within the body and the systems. There are additional labs that are sometimes ordered. Many of our veterans may be familiar with these labs. It's like your routine lab works where we're checking your blood cell levels in your body. We may be looking at your cholesterol levels. If you are a diabetic, we may want to look at glucose and what we call a hemoglobin A1C level. But it's very comprehensive in terms of what our providers are assessing for. These type of exams usually occur yearly. And if there is anything else that's needed for that exam, your provider would have a discussion with you and order as needed to follow up as well. Next is what I would call a problem-focused follow-up appointment. I'm sorry, let me backtrack for 1 second. Usually annual physical exams also can be anywhere for a 60-minute time block as well, because they usually take a little longer and they're very comprehensive when a provider is covering everything that's happened from last year to this year, especially if nothing else has come up and changed. It's their opportunity to be thorough, and it's also your opportunity to share anything else that may be needed. At times, our providers could also focus on social determinants of health, any other additional mental health screenings that may be needed as well to help support your overall health and well-being. Now we'll move forward to a problem-focused follow-up appointment. So there are two options that usually happens when us as clinicians say problem focus. One could be a sick visit. So coming in for a sore throat, a cold, you hurt your finger, you stubbed your toe. Those are what we consider to be sick visits. The other could be a condition-focused follow-up appointment. So if you have diabetes or hypertension, if you have thyroid conditions, if there is stress management, if there are some abnormal lab findings that the doctor wants to review with you in person. These are what we call condition-focused appointments. They're focused on a specific condition with the goal during that appointment to provide education and the appropriate needed care plan to help support your ongoing treatment needs. Usually these appointments are about 30 minutes in nature, but the frequency and the cadence of how often you would need these are determined by your provider. So what I mean by that is I'll use diabetes as an example. If we have someone that relatively has a high level when it comes to their blood sugar and their hemoglobin A1C has been a little high, and the doctor is actively working with you to manage through medication, diet, and exercise, the doctor might want to follow up with you every 3 months. If someone is coming in for hypertension and we've recently just done a change to the medication, that frequency may look a little different. The doctor might want to see you in 2 weeks to check in and follow up and see how things are going. And then they could quite possibly push you out from 1 month to 3 months, depending on what you're working on together and how you're managing those symptomologies. The same could be for a sick visit or cold or other problems. So if you had a broken finger, there may be referrals that are made to orthopedics and follow-up appointments with them that may be the same level or time slot, but then that primary care provider might bring you in maybe after a surgical procedure or after that follow-up to check in and understand care goals together to make sure we are aligned when it comes to helping to support your health and well-being through the specialist and the primary care provider. Next is what I would like to call your sexually transmitted infection testing. This testing is specific to any female veteran that is sexually active and may either be prone to risky behavior or may not be and just are looking to be safe and understand their risk. So this does include a pelvic exam, at times with specific vaginal exams and swabs that may be needed. At times there may also be lab tests that's needed as well, which can include urine samples as well as any additional blood work if someone identifies being at high risk. Frequency of this again depends on sexual risk, or sometimes during sexual encounters with our partners, mistakes happen where we're concerned. And sometimes that concern can be about STI if we're unsure. Sometimes we realize that the act alone can kind of flare up our vaginal flora. And there may be things like a yeast infection that we may be concerned about. And when you're unsure, we have these appointments available so that your provider is able to do the appropriate exam, help manage symptoms together, and follow up appropriately. Also, this type of testing and this type of evaluation sometimes does occur with a well woman exam, but it is not exclusive only to being completed during a well woman exam. It can be completed when symptoms arise that a veteran may be concerned about, or it can be a request because maybe you were notified from a partner that there may be a concern and you need to come in and have additional testing completed. Next, we're just going to take a quick look at new happenings. So the one that I am so excited about is our Women Veterans Drumming Group. So this has been spawned specifically for the day retreat that we were hosted back in September to celebrate our 100 years of healthcare for our women veteran. And we have been looking for an amazing opportunity to continue to collaborate with our creative arts group. And this is one way that we're going to get started. So this group will be Monday evening starting March 25th through June 24th. It will be located at our Loch Raven complex in Baltimore. If you are interested, I need you to contact Jenny, our creative arts therapist that is helping to co-host this event with us. There is a quick little pre-screening that Jenny will do with us, but her email address is listed here, which is jennifer.moyer2, the number 2, at va.gov. So she will help connect and get you slated to be able to participate. This will run for 12 weeks consecutively. And then after that, we will reevaluate and move into the second phase. The hope is that we will be able to bring this to different locations. And that's what we're doing. So we're starting in Loch Raven, but the hope is to be able to do a session on main campus here in Baltimore, explore places like East Baltimore, if that's even available, or even our Glen Burnie. So we know on a Monday evening, it can sometimes be a little bit difficult to drive into Baltimore, but we are working to explore the additional possibilities to extend outreach and create groups that are both supportive and nurturing and inclusive to our women veterans, where you have an event and a structure set up just for you guys, like the requests have been that I've been getting recently. You really enjoyed the day retreat, seeing all of your women veterans there together, laughing, incorporating, growing, and focusing on well-being together. So we're working very hard to continue to create moments like that moving forward. Next is our Strength and Recovery Drop-In group. This is a monthly process group designed to offer ongoing support to our veterans who've experienced military sexual trauma. There is a women's group that occurs the first Thursday of each month from 10:30 a.m. to 12 p.m. And then there's also a men's group that occurs on the second Thursday of each month from 10:30 to 12. If you have any questions in regards to how you get signed up, or just questions specifically about the group, you would contact Dr. Christine Calmes, and her phone number is 410-637-1231. So just a little bit on our additional resources. Just as a reminder, we have a women's health clinics scheduled across our campuses, and all of our locations that are able to provide primary care has a comprehensive women's health medical provider available to help support your ongoing healthcare needs. When in doubt, I find that the Women's Veterans Call Center is very helpful for a number of our women veterans. So listed here is that phone number in regards to how to get in contact with them, as well as their hours. At times, they are able to help with things with quick resources and provide access to quick phone numbers that you may need. But also at times, they will send a referral directly to the appropriate location to help get you coordinated with the available resources that are needed to help support anything that you need. Most of the referrals that come through here are directed specifically to me, and this amazing team that's on the call with us at times helps to support what's needed to access care or get the appropriate information to our veterans in a timely fashion. And then we're going to open things up to any questions that we may have.
Okay, so thank you, Ms. Kirksey and Dr. Starpoli, for that wonderful presentation. So at this time, we'd like to hear from you, from our veterans. Please enter your questions or your feedback in the chat section on your screen. While we are waiting for the questions to be entered, please remember to protect your privacy. Do not mention your personal health condition or any personally identifiable information. If you have a specific medical concern, we ask you to contact your VA provider. I will read the questions out loud, and we actually had a couple that came through. The first one was, were they going to have a copy of the slide deck?
Yes, Public Affairs does a great job of posting the slides up online when they also load our presentation, the video recording from the presentation.
Okay, and Dr. Starpoli, one of the questions was about if they had a skin condition, how would they access care? And you said you would be talking for a second about the PACT program.
Yes, yes. So, if someone has a concern about any kind of medical change or any medical condition, they can certainly make an appointment with their primary care physician or nurse practitioner, and that can be addressed there. I certainly encourage people to bring up their concerns because there are a lot of things that go on at a medical visit. There's a lot of screening. There's your concerns, there's your physician's concerns about high risk and explaining that to you. So, yes, if you wanted a doctor to check you over because you were concerned about something, I would absolutely bring that up. One of the other things that I did want to bring up is that, it's not just doctors and nurse practitioners that are part of our primary care teams. Primary care is very interdisciplinary. We have what's called the patient aligned care teams. So each one of these teams has a physician or nurse practitioner on it, has an RN on it who is your care coordinator and one of your main sources of contact, whether it be by phone or it be through our secure messaging service, which is a patient portal where you can email essentially with your team. There's also we have someone that can help to schedule on your team as well. So that's kind of the core of our teams. And then outside of that, kind of another layer outside of that, we have a clinical pharmacist that's part of our team. So if you have questions about your medications, or if we have concerns about your medications and interactions, or if you are thinking about becoming pregnant, we can have our pharmacist intervene. Or if you are confused about medications, whether you've been discharged from a hospital or you have other physicians outside the VA or specialists involved with your care, they can help to sort everything out for you. We also have mental health people that are part of our patient aligned care teams as well. So it's really a group of people that are involved from all different disciplines. And sometimes it's better, I think, if you can access some of those people as well. It may go through your primary care physician or nurse practitioner, but once you're established with those people, you can reach out to them as well. So I think it's, often if you have a chronic condition, our pharmacist can follow you and make medication adjustments for you if they're small, and you can be seen very frequently with the help of all of our other care team members. So I hope that was kind of a long-winded answer to your question.
Okay, so Ms. Kirksey, we have a guest that asks, how can we change our PCM within the women's program?
So you can change your primary care provider with an MSA at the front desk. You can either call in, and the number to the Women's Health Clinic here in Baltimore is 410 605-7000, and the extension is 54981. So our MSAs at the front desk would be able to change your primary care physician.
Right, and the other option is to call the site if you're at one of the CBOCs, and you can request to have your physician changed, and they will enact that at a CBOC. So you can call the general number to a CBOC and ask for a change. You can change to another women's healthcare team or another primary care team.
Okay, and Ms. Kirksey, are we planning any other retreats for this year?
So I am working on it. Location, location, location is everything. So I am looking to find a great location similar to the one that we had, but actually has a little bit more space. And then there will be some additional information that will come out once I establish the location. I would think late summer, early fall is where you probably can be anticipating or expecting another retreat.
Okay. And can you remind us what the dates for the Lock Raven group are on Mondays?
Sure. So it is going to start Monday, March 25th, and that will run through June 24th. So there will be 12 consecutive Mondays, and then we will
Okay.
complete that session and then start another.
Okay, and are there currently any other activities, or are we planning any other art programs besides the drumming?
So we are. So I am working together with Kelsey, who is our creative arts director, at looking at additional opportunities and partnerships. That was the first one that came up that we're working with, but we are actively working together to determine some additional creative art groups that we want to provide and focus on throughout the year. This is just the first one that got started right away, but there is some creative art and drawing groups that is provided as well. When we post the information for this deck, I will see if I can get a copy of their latest offerings. It may not be specifically targeted towards women veterans, but they do have a nice suite of activities that you might want to participate in.
Okay, and are there therapy groups for women that aren't related to MST?
I'm
Does
gonna let
Dr.
Rachel take
I
that.
was
Yeah,
gonna say
Dr.
Dr.
Austin.
Austin's on? Yeah.
Yeah.
Hi there. Yes, we do have many different groups. I'd be happy to drop in the chat. We have a general women's mental health group. We have a peer led by our women's health peer specialist doing an 8-session group that focuses on all themes, life transitions, balance, self-esteem. We have some perinatal focus groups. We have a 4-session group that's called ROSE, which stands for Reach Out, Stay Strong Essentials for Mothers of Newborns. That's a evidence-based treatment for prevention of postpartum. And then we also have a postpartum education and process group. We have a women's health pain management group, so non-pharmacological approaches to managing chronic pain, which is run by many different providers. A women's anger management group, and then, like was mentioned before, the military sexual trauma group. And lastly, we have a women's spirituality group. So I'm going to drop all of this in the chat. You can get referred through your primary care physician. I'm also happy to drop my number in the chat if it's easier just to call me to place those referrals and go over additional information. And the military sexual trauma group, Dr. Kama's number was on the previous slide.
Okay, the next question is actually a comment. It's a thank you. And they indicate this has never been offered, so I believe this is related to the Well Women visit that we have for people saying that her visits with her provider have lasted 10 minutes or less. I would like to also make sure that people recognize, as Dr. Starpoli said, it's a whole team. So part of your visit will be with the nurse, will be with someone asking screening questions, will be other team members who will be in there with you as well. Okay, how can
But
we
if there's
address?
hold on, Dr. Marshall, if there
Oh.
is a concern that your actual care needs are not being addressed during the appointment,
Mhm.
that is something that you can follow up with myself or Dr. Starpoli, because the point of the appointment is not only to screen for risk, but also to ensure that your care needs are met during that visit as well.
Thank you. And so we have a question about care in the community, approval and recertification. So she knows of a few people that have had their continuity of care being affected because of issues with care in the community. And I didn't know whether you wanted to talk about what we discussed the other day about maternity care,
I'll
Ms.
talk to
Kirksey, but
Yeah, so I can
mhm.
talk a little bit about understanding that care in the community has went through a process change and it is affecting everyone. But what I will say is myself and Dr. Starpoli have been actively and aggressively working with both care in the community and our providers to lessen that impact to continuity of care being affected. So there was a system-wide process change, not just for our VA, but for many VAs, where the way and the process of referrals, even recertifications are being put in may not necessarily come directly back to maybe your women's health or primary care provider that put in, because now we have point of care contacts in specialty areas. So just to give an example, if it was for dermatology and maybe Dr. Starpoli put it in, it's not going to necessarily come back to to Dr. Starpoli for recertification. It may go to dermatology, and then there's this conversation that the dermatologist may want to have with Dr. Starpoli to understand the care needs to recertify and approve for that continuity of care of moving forward. Some of the other things that Dr. Marshall and myself have talked about and thought about is also being able to help ensure that our veterans are able to kind of self-schedule for specific appointments. And we're working that out also with care in the community to lessen that effect. Now, realizing that we definitely have to get the approval and recertification completed first, but then also making things easier to allow our veterans that can be able to self-schedule appointments and coordinate care appropriately.
And I can let people know that we are moving towards more self-scheduling, in care in the community that hopefully will improve that aspect of that program. We did had a veteran that went to Perry Point to the recovery center and took some classes in Tai Chi, yoga and mindfulness, and then she received a bill. And I'm sorry to hear this, for $200. She was never informed that there were during the orientation there would be a copay. So she wanted to know whether there's a copay for any of these women veterans groups that you're describing tonight.
So I will follow up with Jennifer and get that information posted. To my knowledge, there should not be a copay. I do realize though that some of our veterans do have copays for different services they come in with, but I don't think the groups are one of them. But what I can do is double check with Jennifer and get that information back to make sure and ensure that Jennifer, who will do a lot of your pre-screening before getting you signed up, is aware to provide that information if in fact it is, especially if that changes your mind as to whether or not you would like to participate.
Okay, I'd like Ms. Pope, if she's available. Can you provide some information about the caregiver program and the different levels of support? Most of the times I see women as caregivers for their family members. They have information for the kinds of support available in the community, including virtual care groups.
Sure. Can you all hear me?
We can.
Okay. So I am not a part of the caregiver support program, so I will provide brief information and overview regarding that. And then I can also put their information in the chat as well. I know they do have different support groups available. There is a general caregiver support group available for all of our veterans as well. I do believe that some of the veterans can attend that group, even if they are the veteran caring for someone else. There's also the Comprehensive Caregiver Support Program. That is the program with the stipend and things of that nature. If you all would like, I can put that in the chat, but I am honestly out of the loop regarding the Caregiver Support Program because that is separate.
Right. And so I used to participate as one of the intake people for the caregiver support. And so you're correct. There's the general program, which is open to everyone. There is the comprehensive program. And I don't know who just put that up in the chat box. I mean, in the screen, it keeps coming up and then going down.
it's like
It's
flagged
me.
out.
I'm trying to see how I
Okay.
can drop it in the chat for everyone.
Right. So that explains the difference between the two programs, the different levels of support that you can have. Prior to COVID, we used to have an annual caregiver support day where we would have a lot of speakers come in, a lot of giveaways and things like that. We'd like to get started back doing that again now that we're post-COVID. But there is an intake and there is an evaluation for determination of eligibility for the comprehensive caregiver support program. And one of the things that we were able to do at the group meetings was to provide information about support groups and things that were available in the community with the staff there. So If we can get the caregiver support information, how to contact them, Ms. Kirksey, that'd be great to put that in there.
And there
So-
is also the National Caregiver Support Line. They're
Yes.
able to give you information as well. I believe they're still open till 8 p.m. If you're also having like a bad day, an off day, or you're just unsure of what other resources there are out there, you can call the national line. They can give you information, and they can also refer you to local. They can also help advocate on your behalf as well.
We have a veteran who's having difficulty getting anyone to return their calls for CITC, for Care in the Community. Can I ask Ms. Kirksey if they email you with their information, we can get them connected to the right person?
They sure can. They can either
Yeah.
email me or give me a call. I will forewarn, I'm at a outreach enrollment affair tomorrow, but my office phone number is 410-605-7275. So you can reach out to me directly and leave me a message, or you can most certainly can email me. And my email address is S as in Sam, I as in Igloo, O as in October, B as in Beta, H as in Henry, A as in Alpha, N as in Nancy, dot, K as in Kite, I as in Igloo, R as in Robert, K as in Kite, S as in Sam, E as in Eggs, Y as in Yellow, at va.gov. I will help navigate and help support any way that I can to help figure out what's going on and get you access to care and questions answered.
Okay, Ms. Kirksey, they want to know how they can get on the email list for upcoming events and additional groups that we have.
So I pull a distribution list with help of public affairs for our enrollment group. So if you are enrolled and we have an email address on file, that would be how I am able to connect and get in contact with you and ensure that you have any updated information. I also do work with public affairs to post anything that I am hosting and have going on to our social media accounts as well. And I actually digitally work to ensure that, if possible, we do some quick mailers as well. We are working hard within the Women's Health Department to set up our own kind of page that we can change and provide updates a little bit more frequently. So there will be more to come on that, but we will, once we have everything up and set up, you will be able to have access to be able to see things more timely, especially our different groups, because this group that I work with is absolutely amazing. And I feel like we create new support groups and new offerings in different areas, whether that is within our clinic environment, but also to help support our whole health and holistic options as well.
Okay, our next question, and I'm going to ask both Ms. Pope and Dr. Austin and Ms. Kirksey if you have any information. They want to know if there are any virtual online support groups for women veterans that take place after normal working hours, so after 5 p.m. Do we have anything, or can we refer somewhere?
So out of the groups that I know right now, I don't think any of them are after hours as of right now. Maisha or Dr. Austin, to your knowledge. So we'll have to work on that.
Yeah, and if we don't have something, is there something in the community that we could suggest?
To my knowledge, we don't have any right now. I know a lot of people get off at like 4, 4:30, and 5.
Mhm.
Depending on what type of support groups you're looking for, there may be support groups through like SAMHSA and things like that. But to my knowledge, there's not any that we have within VAMX.
Yeah, I would echo that as well. I think that's a kind of project we could take on because we're over time really trying to form relationships with our community partners. Like just today, I heard about a program that's offering a lot of services for women veterans. So definitely need to link and see what their offerings are. I know for folks that are in the perinatal or postpartum or have young children, that postpartum.net does have fabulous groups for parents. Vet centers typically have some evening groups, although I'm not familiar with any women specific groups, and Easter seals. So I'll drop these in the chat too, but definitely noting that that's a gap area.
So,
So I will
I'm-
look for our community partners. I have a few, but I don't have anything in front of me now to determine what is specifically available when it comes to the community partners that we work with and any of their groups that they may have that is available specifically offline.
and I will tell you, we have an annual mental health forum, and we also have a monthly meeting with our veteran service organization. So when we have our meeting this month coming up, I will reach out to them and the Maryland Veterans Group and some other groups that are there and find out and share that information with Ms. Kirksey if there are. But I agree with you. Thank you for identifying that. That's definitely a gap that we have. So one of our guests wants to know, Ms. Kirksey, is it better to email you because she called a while back and hasn't heard from you? So is email better? I know you're in and out with.
I'm in and out because, of course, there's a lot of outreach groups going on. I would say the best way to actually get me is my mobile. I do periodically check my voicemail, but it does get overwhelmed if I haven't been back in the office. So my work mobile phone number is 443-691-5687. And I'm actually open to texting that number also. For some of us, texting is a little bit easier. So you also can text that number as well. Email is also easier. My work phone travels with me and I can check emails on it as well. In my office, though, I will say I've been working with our phone team because there's been a little bit of issue of me accessing messages. So if I have not gotten back to you for some reason, I do apologize, as I've been working very diligently with our phone IT team to figure out what's going on. Messages are either dropping, meaning I do not get a complete message to even call you back, and I have no way to look up the phone number of a previously called person. So there's a lot of things where it just seems like it's a hang up call. And I doubt very seriously that I have 10 messages that are just hang ups. So I've been working with them to ensure that your messages are not being cut off short when I'm having those type of issues.
Okay.
Hello. Can I? Oh, hi, this is
Go
Dr.
ahead.
Yates. I wanted to make a quick comment from the earlier post on the classes of Tai Chi yoga mindfulness where the copay came up. I would please let me know. We do have similar classes. They're virtual and they're run through PMRS, so the physical medicine rehab, and none of those should have copays. We have had incidences in the past where people were mailed a bill and they brought it to our attention and they did not have to pay the bill because you should not have a copay. So I am not sure for this scenario um, if the bill should have even gone to you or if it was through like physical occupational therapy services. But I would be happy to follow up with one of the Perry Point or at least the PMRS person at Perry Point if it was a concern. And I'm just gonna drop my email in the chat as well.
Okay, so the request, Ms. Kirksey, is for us to start developing our own VA support groups.
So
but
I
we-
think the bigger request is that you want us to develop them after hours because
Yes.
Maisha and Saya and Dr. Austin and Janita and Maisha, they all have developed amazing support groups. But the real issue is we need to start developing a few after hours to help support, and we'll look into that.
Okay, and our veterans and are always wonderful to each other. So someone put in here that NAMI.org. You can look up and see what groups are offered in your area, and that is one of the groups that comes to our annual forum. And we have worked with them. Dr. Vega Sanchez put in that postpartum.net is an option for you. Dr. Austin put in again postpartum.net, the vet centers and Easter seals. And now I'm having trouble getting the cursor to move here. I happen to find out tomorrow about this meeting, but I know I'm on the list to get more information. Very good. And then Dr. Let's see, it's Miss Pope put in the VA Dementia Caregiver Support Group meets. Wow. You're having trouble with your phone. I'm having trouble with my computer. It is meeting every Friday from 2:30 to 3:30. Call for the meeting schedule. They're located. They currently do have a VVC referral contact. VVC is our Video Connect, and they do have the psychology, neuropsychology number there. The caregiver support line and the hours of operation are there for you to call. Ms. Pope also listed SAMHSA, which is also another group that you can get services through for support groups. We ask that you repeat your mobile number again. You're going to stick it in the chat box too,
I
right?
did. I dropped it in the chat box,
Okay,
but I
so it's
can
in the
repeat
chat
it
box
really
now.
quickly if needed. It's 443-691
Mhm.
5687.
Okay, and we also have a finest support group for mental health, drugs, alcohol. That is in there. We also have an individual who said they've been identified as having dense breast tissue, or if a person has been identified as having dense breast tissue and requires a follow-up ultrasound every year, is there a way to get them both scheduled on the same day to avoid 2 long trips?
Dr. Starpoli, do you know the answer?
Yeah, I can answer that. In general, you can coordinate radiologic studies through the radiology scheduling line. In general, our radiologists don't recommend following dense breasts with ultrasound unless there is something that is concerning in their readings. For example, if people are being followed with a diagnostic mammogram, they may or may not get ultrasound based on the radiologist's findings. And when people get a diagnostic ultrasound, the radiologist is right there to look at the pictures and decide what else is needed, as opposed to a screening tests where the pictures are taken and reviewed later. But I think the question is, can you get 2 studies scheduled at the same time? And the answer is yes. If you speak with the radiology department, they should be able to coordinate that for you, given
Okay,
that
so,
things are due at that time. Yeah.
and I see Miss Kirksey's phone number is in there. And I saw Miss Yates put in her email. So the person that had the issue with the bill, please contact her and let's see if that was an error or whether there's an option for covering that. We do have a guest that said that they've had the same issue in calling the women's clinic or other clinics at the Baltimore number, leaving messages and no return calls. Is there an issue with the phone lines? And so we have unfortunately had some issues with telephones and telephone operators. There are in primary care now, there's what's called an ACD phone line where the phones should roll over. But I think Dr. Starpoli mentioned we do have secure messaging. So if you sign up for My Healthy Vet, you can email us. We do monitor emails regularly, and any email that's not answered in 3 days is escalated to the next level of supervisor to make sure that that is addressed. And that's a much easier way to monitor the requests that we have for incoming questions. And Dr.
Yeah,
Austin just went all out and just put a whole bunch of resources in the chat box. I hope everybody can see. And I'm sorry, Dr. Starpoli. Go
no, I
ahead.
was going to say that the secure messaging is a great way to get in touch with all your care teams. You can get through to your primary care teams. The secure messages can be viewed by anybody that's on your care team, but you can also reach your specialist directly through the My Healthy Vet app and the secure messaging when you sign on. So that you can ask for appointments and things like that through there and avoid the phone tag if you wind up having to leave a message and then people can't get in touch with you and all that. The asynchronous venue of secure messaging, which is basically our emailing, is a great way for people to be in touch for non-urgent issues.
So we have a guest who put in some additional information. It's a new book on women's health called All in Your Head by Elizabeth Comer, MD. Discusses how early medicine taught us about women's bodies and why this matters, especially in the VA where men have been the focus for so many years. So I don't know if anybody here has read that. But thank you for sharing that. It's something we'll go ahead and get. We have a thank you for hosting it, and the individual said it's been very informative. We have another veteran who said that secure messaging is a great resource. So yeah, please use secure messaging. And then Ms. Kirksey also said she can send out the caregiver support information. So we have another guest who said, when we retire and enroll in the VA healthcare system, what happens with our prescriptions? I'm going to ask Dr. Starpoli to
Yeah, sure. So if you're
You know, you don't
seeing
have to
some,
wait till you retire to enroll, right? That was the first thing
that
that
is
struck
true.
me.
That is true. And our women veterans, are very young. The average age of our women veterans is in their 40s, 50s. That's a huge peak. So no, you did not need to wait until you retire to come and be with us. But as far as your prescriptions, we usually ask when people come and enroll and see, it's usually the primary care team for the first time to bring a list of their prescriptions and maybe some notes from their previous doctor, so that we know what's going on and we know that the correct doses that are being prescribed, and certainly things that are usually prescribed by an outside primary care doctor, we may be able to fill for you here and we may be able to take over your care. We can also co-manage along with your outside doctor. If you have specialists, that's another situation where we may be able to help you out with prescriptions if we're able to write that from the primary care clinic. Sometimes if you're on very highly specialized medicines that we don't normally prescribe, we can get our specialists involved. So yes, for the most part, you can roll your prescriptions over here. We might have a slightly different formulary than what you're on, but we definitely have equivalent prescriptions.
And one thing people sometimes get confused is we always use the generic name for the medication, whether we stock the brand of the medication or not. So sometimes people think that we're prescribing all generics, which is not true, but we always prescribe medications that has been clearly vetted by the FDA as been equivalent if it is a generic formulation. So, okay. So the next question we have is, how can we get our different teams activated within My Healthy Vet? If the team is not activated in their account, they can't message them. Is there any way to get My Healthy Vet access to clinics?
I can answer that question. Yeah, what you would need to do is everybody will get hooked up with their primary care team. Once you're assigned to the primary care team, you should have access to them. If you want to get in touch with one of the specialists, what you can do for the first time is just send a message and ask the primary care team to forward it to the specialty clinic or to the particular clinician that you're trying to get in touch with. That can be done by anybody on the primary care team, the RN, the physician, whoever happens to read it, and that will allow you to have connection with the subspecialists. For some reason, because you don't really get enrolled with the subspecialist, it sort of has to be done by hand. But if you just ask, on the primary care team, they can just send the message there and they can just click a box that says that you'll be able to email that team in the future.
It's great information. And they'd like to know about our resources for weight loss. And I don't know whether Dr. Starpoli or who would like to take that question, because we could talk about the MOVE program and all the other
We
good things.
we can talk about the MOVE program that is recently getting started. We do have some collaborative efforts going on with them. It depends specifically though what you're looking for weight loss. So if we're talking about bariatric, that's a little bit different and would be handled with your PCP. If it's our MOVE program that focuses on healthy eating, diet, and exercising appropriately, that is a separate group. But we are, as a group, as this team, looking to incorporate things so that you have access directly within the Women's Health Clinic as well. So as Saya mentioned on the call, Dr. Yates, she does our Tai Chi. We work together with a yoga group and other movement activities to help support. So it's really specifically about what resources you are looking for. And that's a great question to have with your primary care team, because there is something for everyone here. I will say that. So more than likely, if you are interested, we have it in place to help support.
It looks like Dr. Yates wanted to say something.
Yes, thanks, Siobhan. There are a lot of different, so we have mostly virtual exercise programs set up now. There is also a PGA Hope golfing program, but like Siobhan said, there is a lot on the movement front. So there's Tai Chi, there's seated yoga, there's seated Tai Chi, there's kickboxing that runs weekly as well. And oftentimes if you talk to primary care provider, they can put in, it's like an integrative rehab consult. And then someone calls you and will run through the list as well as give you the schedule of days and times just to see if it fits your schedule. And then a lot of times when you start with one of the programs, you'll get, oh yes, kickboxing is Monday and Friday. My manager, Kendall, runs that. But if you would like the schedule, actually, I'll drop it in the chat now. Okay.
And the other thing I
Thank
wanted to
you.
bring up is that we, for the last year, have been working very diligently at looking at healthcare. It's called disparities. We like to look at it as healthcare equity, recognizing that there have been a difference in outcomes and treatments for people of different backgrounds, whether it be due to their gender or to race, or whether they live in an urban or a rural area. And so part of that is our dietetics group is doing a healthy kitchen program where different days of the week they have programs where people can come in. They're looking at culturally diverse menus and healthy eating options, but then they're also going to do cooking demonstration type programs so that people can come in and learn how to make the food that they love in a way that will love them back. And so I'll see if we can get that to Miss Kirksey, and then we can provide that information as well. Because yes, as Dr. Yates said, there's something for everyone. And what Miss Kirksey said is it's whether you're looking for exercise, whether you're looking for diet and education and cooking, or whether you're looking for bariatric surgery, we do have those options available to you.
We are right at
Okay.
the top of the hour.
We are. Well, I want to thank you all for joining us again this year for our Women's Veterans Forum and for participating so actively. Oh, and it says GeroFit. Yes, we do have GeroFit. And that's for our veterans who either want to go out to Loch Raven or can do this virtually. But let me get back to thanking everyone for being here tonight, thanking you for participating to help us better understand your healthcare needs so we can work to ensure we are providing safe, quality, and compassionate care in a sensitive and welcoming environment for all of our women veterans. As we mentioned earlier, please look for an email invite to our next forum in 6 months. I want to thank everyone and have a great evening.
Have a great evening, everyone. Thank you so much for joining us.